Blog Talk Radio.
Welcome. This is Andy Marino. We have with us today Dr. Daniel Perlman. Dr. Perlman, MD, MBA, is a practicing infectious disease specialist in Colorado. He graduated from the University of Maryland School of Medicine. He completed his residency in internal medicine at Johns Hopkins University School of Medicine and his fellowship in infectious disease at the University of Maryland School of Medicine. His fellowship also at the University of Colorado Health Sciences Center. Dr. Perlman is a member of the Infectious Disease Society of America, the Colorado Medical Society, and the International Association of Physicians in AIDS Care. He is board certified by the American Board of Internal Medicine in the subspecialty of infectious diseases. Dr. Daniel Perlman is our guest today. Dr. Perlman.
Thank you. I'm glad to be on the show.
Welcome. I'd like to, if you have a minute, just to chat a little bit about your introduction. Tell us about yourself and your practice.
Well, I have a infectious disease practice with a number of doctors who practice infectious diseases in Denver, Colorado at several hospitals. We take care of sick folks who come in often through the emergency department. They might be admitted to the ICU. We also are involved in infection control, which is the part which involves isolation of patients for contagious diseases in the hospital. So we might recommend that a patient be in a room that's a single room, and isolation such as gloving and gowns is required to visit that patient. So we also take care of a variety of different diseases, from mild disease to very severe disease.
Wonderful. Can you explain to us your practice in treatment of patients that have been involved in foodborne bacterial pathogens?
Well, basically there's a lot of standards for the practice of medicine, and these are called evidence-based medicine. And these standards have different background in terms of the amount of evidence that is positive and negative for taking care of any particular disease. But most of the time, when a patient arrives at the hospital, they haven't been diagnosed yet with a particular bacteria, and so we don't know what we're treating, and we have to use broad-spectrum antibiotics. So we'll give a patient who's very sick, for instance, 3 or 4 different antibiotics while we await the return of the specimens from the microbiology lab, where we hope to get information about what kind of bacteria or virus is isolated. And sometimes that process can be prolonged for several days.
Wonderful. Now, in your experience and your practice in Colorado, what has been your practice experience with the recent listeria outbreak in the state?
Well, basically, we've had a barrage of questions to me and to my partners in relation to the listeria outbreak. This is an outbreak that started in Colorado. It's been isolated to Jensen Farms, which is in a small town called Holly, Colorado, which is actually near Rocky Ford. The cantaloupes are famous and often get labeled Rocky Ford melons. And there's various different labeling for these melons. Some of them are labeled La Frontera. Some of them are labeled Jensen Farms. Some of the cantaloupes have been sold to processors that have cut up the cantaloupes and put them in their own labeling system, so it's hard to identify where the original cantaloupe came from. So in terms of taking care of the patients, they will present to the emergency room and be admitted to the hospital. I can tell you about some of the patients, particularly if you're interested.
Yes, without giving away any particular information about them. Just their case study.
No, I wouldn't disclose any confidentiality on the part of the patient. But in reference to the type of symptoms, normally the Listeria bacteria, it causes a bacteremia, which is blood-borne bacteria. And so the blood cultures that might be taken will turn positive in a day or two, usually for this bacteria. The people that are getting sick from the cantaloupe are generally elderly or immunosuppressed in some way. So if they're taking steroids, I haven't personally seen any AIDS patients with Listeria infection, but this would be another risk factor. Any person who has cancer, their immune system would be somewhat depressed or suppressed, and so these are the types of patients that we see, or patients that have a long laundry list of complicating factors. The patient that I recently saw actually had meningitis, and basically this patient had congestive heart failure, chronic obstructive pulmonary disease, and was also immunosuppressed with rheumatoid arthritis chronically. So there were a number of what we call comorbidities present. So this is the kind of patient population that is mostly involved. I'd like to mention one other factor, that between the time that you eat the cantaloupe that is contaminated with the Listeria bacteria, there can be a long delay while the bacteria are incubating. It's called the incubation period before you become ill. You may feel tired. You might have some fevers. You might have some achiness. You might feel flu-like in the initial stages of the illness, and it may take as long as 2 months or more. So we have seen, looking at this epidemic, the curve of the epidemic is still going up. There's been approximately 21 deaths that the CDC in Atlanta has related to the cantaloupes. I think 25 states have seen illness approximately from this outbreak, and 21 deaths. We expect to see more illness and deaths in the coming weeks because of that long incubation period.
Now, Dr. Perlman, you mentioned the specific categories of persons that are particularly liable to this or susceptible to these pathogens. What are the likelihoods of young children also falling victim to these pathogens?
Well, personally, I haven't seen or heard about any young children. Listeria in general could cause a problem in very young children, and pregnant women are also at risk. Personally, I haven't seen any cases in relation to that area, but certainly if you were pregnant and you started having some fevers and achiness and you were becoming ill, you would want to seek medical care, especially if you had a consideration of eating cantaloupe. So those are risk factors certainly that need to be mentioned as part of this discussion. Most of the patients, according to the latest report from the CDC, the median age of this outbreak in people is around 77 years old. So it's mostly affecting older people with many medical issues.
What is your general experience with foodborne pathogens? Is there something the consumer themselves can do to protect themselves?
Well, that's a very good question. You know, it's very difficult as a consumer to understand where the food comes from. And when you're entering a grocery store or supermarket, there is going to be food there from around the globe. And because of the globalization of the distribution chain